Hi there, this is Doreen, your Student Success Specialist, and this video is going to be a quick review of critical care drug calculations. Here is our first question, and as always, I recommend that you read the end of the question first so that you know what you're wanting to answer. And in this case, it's saying how many units will you administer. So we know that my label is going to be units. I'm going to go ahead and write that in there. And then I start to look at the question. My order is administer a bolus of heparin sodium IV at 65 units per kilo, and the patient weighs 74.5 kilos. Okay, so this is important for me right here. I want 65 units per kilo, and my patient's weight is already in kilos, so I don't even need to convert that. So I am simply going to take 65 units times how many kilos, 74.5 kilos. I'm going to march that math out. 65 times 74.5, and I get 42.5 units. And I should have written it right there. Make sure you write it on the box to make sure the grader knows what your final answer is. So I'm going to multiply my number of units that I want times my weight, and that's going to be my final answer. And I'm not going to round this right here. I'm going to keep this to the 10th because remember the MAPE policy says most numbers are going to remain to the nearest 10th. And in this case, I'm going to keep that number right there. Okay, let's go ahead to the next problem. Okay. Again, I'm going to read the end of the question first. What is the client's weight in kilograms? And I know this is really silly and easy, and I know you know how to do this, but I put this in here pretty quickly because many students start with all these numbers and calculating and trying to figure out my weight, how many kilos per hour. I'm going to put my weight into kilos, and we waste a lot of time. And in this case, all I want to know is my weight in kilograms. So what is what am I going to do here? I'm going to take 165 and divide that by 2.2, and that's going to be 75 kilograms. My final answer. Okay, so make sure you just read the end of the question first, and then you know what to look for, what kind of problem, what you're looking for, because we know that none of this really matters for this particular question. Okay, next question. At what rate will you set your IV pump round to the nearest tenth? Okay. So I'm going to have a pump rate. So I know that's an hourly rate. I'm going to look at my order. I got levofed drip 7.5 micrograms per minute. That's going to be important. And what do I have available? Levofed 4 milligrams and 500 milliliters. Okay. Now one thing I want you to notice is that my order is written per minute and my pumps are written per hour. Or not written, but that's how we set the pumps, as a per hour rate. So the first thing I'm going to do is I'm going to make this order into per hour. And if I take 7.5 micrograms times 60, I'm going to get 7.5 times 60 equals 450 micrograms per hour. That's my doctor's order. All I did was put this in hours because I know that my pump is going to go per hour. So that's why I wanted to go ahead and convert that first. Now I know that my, well, you know, let's do one more thing here. We have this concentration here, and you don't have to do this, but I like to have my concentration to be a little bit more friendly. So I know if it's 4 milligrams and 500 milliliters, I need to get this down to micrograms. So that would be 4,000 micrograms, right? In 500 milliliters. And if I take 4,000 and I divide it by 500, just to make so many, all these zeros or just gets kind of messy, I would get the same concentration of 8 micrograms in 1 milliliter, which is a much more friendly number to use. Okay, now I could simply D over H times V. My doctor's order is 450 micrograms. And what do I have? I have 8 micrograms times 1 milliliter. See that? And my answer there, if I march that out, is 56.25, and I would round that up to 56.3, right up here, 56.3 mils per hour. Okay? All right, let's go ahead and take a look at the next one. End of the question first. At what rate will you set your IV pump? Okay, so I'm looking at an hourly rate. And let's take a look. Vasopressin at a rate of 0.4 units per minute. Your bag has 200 units of vasopressin and 500 milliliters. And the same thing, my order is written in minutes, my pump is going to be in hours. So I'm going to take that 0.4 and multiply it by 60 because I'm going to see how many units per hour I'm going to be giving. And 0.4 times 60 is 24 units per hour. And I label all the way through just to make sure I know what that 24 means. Okay? And then I'm going to look at my concentration again. If I have 200 units in 500 milliliters, that you don't have to do this because it's already units to units, but I like to do this. It's going to equal 0.4 units in 1 milliliter. That's just going to make my final math a little bit easier because now I can D over H times V. My doctor's order is 24 units per hour. And what do I have? I have 0.4 units times 1 ml. And if I do 24 and divide that by 0.4, I get 60. So my final answer here is going to be 60 milliliters per hour. Okay, that's my final answer. Okay, let's keep scrolling. What is the hourly rate to infuse 10 units per hour? Okay, so what do I have here? I have Humulin insulin, 10 units per hour IV. What do I have? I have 40 units in 100. Okay, so let's see, 40 units in 100. If I did that math, 40 units in 100 mLs. If I just divide 40 divided by 100, it equals 0.4 units in 1 milliliter. Nice and smooth and easy. Okay, that's my concentration down to its lowest value. And then if I D over H times V that, I know I want 10 units per hour. So 10 is my doctor's order, 10 units. And what do I have? I have 0.4 units times 1 ml. Okay, so if I take 10 and divide that by 0.4, I'm going to get 10 divided by 0.4 is going to be 25. So my hourly rate is 25 mils per hour. Make sure you write that label in, okay? All right, next one. Again, what rate will you set your IV pump? So in this little workshop, all the questions are kind of similar, but when you're on your MAPE, it's going to be more important to read the end of the question first because you know the topics are going to bounce around. It's going to be a drop factor, it's going to be a weight, it's going to be a weight-based calculation, it's going to be all kinds of stuff. So make sure you read the end of the question first when you do that. All right, rate where you set the IV pump. And what do I have here? I have infused heparin at 800 units per hour from a solution containing 40,000 units and 1,000 milliliters of D5W. All right, and this is one where I see all these zeros. These are crazy zeros. So I'm going to take my 40,000 units and I'm going to divide that by 1,000 milliliters and I get 40 units in 1 milliliter. That's just such a more friendly number to use. And now I'm going to take a look at my doctor's order again. My doctor wants 800 units. So I'm going to take 800 units, and I'm going to divide that by 40 units and multiply that by 1 ml. So 800 divided by 40 equals 20. So my answer here is 20 milliliters per hour. Okay, next question. A little bit different here. How many micrograms per hour is the patient receiving? Okay, so now we're changing it up a little bit. I'm going to do the same thing. I'm going to look at this 800 milligrams and 500 milliliters. And if I do 800 milligrams and divide that by 500 milliliters, I'm going to get 1.6 milligrams in 1 milliliter. Okay, but now I see micrograms is where I'm going. So now that I know I have 1.6 milligrams, if I move that decimal, 1.6, and I move that decimal 1, 2, 3, I know that this is 1,600, right, micrograms in 1 milliliter. Yes, 1,600 micrograms in 1 milliliter. And then I'm going to D over H times V. I'm sorry, I'm not going to D over H times V. I'm going to ratio proportion this because if I have 1,600 micrograms in 1 milliliter, I know that my rate is going at 30 milliliters per hour. That's my rate per hour. That's important. Okay. And I know that my X value is going to be micrograms per hour too, because both of these values are going to be the same. So if it's milliliters per hour, it's going to be micrograms per hour. And then I'm going to multiply 1600 times 30, and that's going to equal 48,000 equals X. So my answer is 48,000 micrograms per hour, and that's what I want, micrograms per hour. Okay, so those little details are really important. Okay, let's keep it going. Next question. How many micrograms per minute is the patient receiving? Okay, so let's see. Nipride is infusing at 25 milliliters per hour. The bag states 50 milligrams of nitroprusside in 250 milliliters. And let's do this again. Let's do 50 milligrams and divide that by 250 milliliters, and that is going to equal 0.2 milligrams per milliliter. Now, if I take 0.2 and I want to make that into micrograms, I'm going to go 1, 2, 3. I get 200. So I know that this concentration is 200 micrograms in 1 milliliter. That's my concentration. Okay, so if I have 200 micrograms in 1 milliliter, then I know my rate is going at 25 milliliters per hour. And I know that this is going to be micrograms over here per hour, because remember, they have to match. Okay, that would be my X. So 200 times 25 equals 5,000 micrograms per hour. However, that's not what I want. I want micrograms per minute. And I know you know what to do here. I'm going to take that 5,000 and I'm going to divide it by 60. And I'm going to get 83.3333. Okay, so how many micrograms per minute? I'm going to round that number. Remember, when you round a number, you always look at one number past. So if I'm going to round to the 10th, I'm going to look at the number to the 100th, and that's a 3. So I'm going to keep this 3. So my answer is 83.3 micrograms per minute. Final answer. Okay, we just have a couple more. How many units will the client receive per hour? Units per hour. Okay, let's go ahead and take a look at what we have. We have 25,000 units in 250 milliliters, infusing at a rate of 13 units per kilo, and the client weighs 65.7 kilos. So we got lots of stuff to do. Whew, sounds fun, right? Okay, first we need to figure out how much the patient's going to get. So the client's weight is 65.7 kilos, and we know that they want 13 units per kilo per hour. So I'm going to take 65.7 and I'm going to multiply that by 13, and that's going to be 854.1 units per hour. So I'm looking at these label here, units per kilo per hour. Once I do that math, I'm taking out the kilos because I just multiplied that. So I know that this is the number of units per hour. And actually, look at this. How many units will the client receive per hour? That's all I have to do. I don't have to figure out my rate. That's my answer, 854.1 units per hour. Woohoo! Celebrate. Okay, let's try another one. How many micrograms per hour is being infused? Okay, what do we got here? We have a nitro drip infusing at 15 milliliters per hour. Bag states nitro 100 milligrams and 250 milliliters. So I'm going to reduce my concentration. I'm going to take my 100 milligrams divided by 250 milliliters, and that's going to be 0.4 milligrams per milliliters. And let's see, I want to get to micrograms. So I'm going to take that 0.4 and I'm going to go 1, 2, 3 decimals. That's going to equal 400 micrograms in 1 milliliter. That's my concentration right there. Now I know that if I have 400 micrograms in 1 milliliter, And what am I going at? I am going at 15 milliliters per hour. So I know that this up here is going to be micrograms per hour. My X, it's going to be per hour. So I multiply this out, and I know X is going to equal 400 times 15, which ends up being 6,000 micrograms per hour. And what am I looking for? I'm looking at micrograms per hour. So that's actually my answer, 6,000 micrograms per hour. And if it was looking for minutes, we're just going to divide it by 60, right? That's it. Okay, let's take a look at another one. How many units will you administer? All right, what do we have here? We have a bolus of heparin, 80 units per kilo. Patient weighs 200 pounds. Easy peasy, right? We're going to look at that weight, 200 pounds, and we're going to divide it by 2.2 to get the weight in kilos. And that's going to be 90.9 kilograms, right? Okay, and then I'm going to take that 90.9 and multiply that by 80, and I get 72 units. Final answer. Okay, so just starting by reading the end, units will you administer, and then I just start looking at my values. What do I need to know? My patient's weight and how many units the doctor has ordered here. Just plug those numbers in. Okay, we have one more question left. One more time. Micrograms per minute is the patient receiving. Okay, micrograms per minute. Okay, let's go ahead and see what we got here. We got patient receiving isoprel, 23 mils per hour. Solution available is 2 milligrams of isoprel and 250 milliliters. So let's just start. Let's get this 2 milligrams and 250 milliliters to a more reasonable number. So if there's 2 milligrams in 250 milliliters, that's going to equal 1 milligram in 125 milliliters equals, I'm going to put this 1 milligram into 1,000 micrograms and 125 ml. So that didn't really get my numbers down too nicely, but it's a little bit more friendly, I think. And then I'm going to take this, I'm going to set up a ratio proportion. I'm going to say if I have 1,000 micrograms in 125 milliliters, I'm going to set this up, and I know there's going to be micrograms here and milliliters here, and I'm going to look at my rate as mils per hour. So I know this is going to be mics per hour, and my rate's going at 23, so my X is going to be there. And if I'm going to cross multiply, it's not as clean anymore. I'm going to do 1,000, let's see. Yes, I'm going to do 1,000 times 23, which is 23,000 is going to equal 125 times X. And then I have to divide both sides by 125. And I'm going to get 184. Oops, that's very messy. Goodness gracious. 184 micrograms per hour. Is that what I want? I want micrograms per minute, right? So now I'm just going to take that number and divide 60, and I get, let's see, 184 divided by 60 equals 3.0666. And remember, if I round to the nearest tenth, I'm going to look at this next number at the hundredth. So my answer here is going to be 3.1. I'm going to take the 6 and march up. So it's 3.1 micrograms per minute will be my final answer. Yes? Okay, so really I want to caution you here is read the question slowly, and if your brain is getting really fuzzy and confused, just start breaking apart the numbers. Start breaking down your concentration, getting more friendly numbers, and then just start saying, what do I have and what do I need? I need micrograms, I'm in milligrams. I need kilograms, I'm in pounds, or vice versa. And if you start working your way through the problem, you can go ahead and make your way slowly to the solution. And another thing to keep in mind is when you're taking your MAPE, you have it on paper. Go ahead and get the easy ones first, because that's also going to build up your confidence. And once you have all those easy points down, then go back to the ones that are a little bit more challenging and see if your brain might be a little bit calmer at that time. But you want to make sure you get as many points as you can. So maybe that hard one, maybe you don't even get to completely answer it. You run out of time, and that's okay. But if the last 5 are easy questions, then you scored those 5 points and didn't spend 23 minutes on that one hard one. Okay? All right, well, I hope you found this to be helpful. Oh, I'm just realizing that some some of my writing got cut off. I apologize for that. But I'm here if you need me. You can always email me. I'm doing a lot of Zoom appointments. Students seem to like Zoom as well, so I'm happy to see you live or on Zoom. So I hope to see you soon, and good luck on your MAPE. Bye-bye.